In Module 3.2, we will discuss choosing the distribution site for vitamin A and deworming distribution. In this module, we will learn about the principles of choosing a distribution site to prevent crowding, types of distribution, and the supply checklist required. When choosing the vitamin A and deworming distribution site, we should avoid these 3 C's: closed spaces, crowded places, and close contacts. Choose a site which is away from crowded areas, ideally in the open. If you choose a health facility or barangay center, make sure it is well ventilated and not exposed to rain or under direct sunlight. The site should be easily accessible for everyone. It should be wide enough for people to maintain physical distance. Have a separate entry and exit points, as this prevents crowding. Keep separate hand-washing facilities for the service providers and for the beneficiaries. Types of distribution. Depending on the local situation with the COVID-19 infection, the service provider can conduct the distribution either at a fixed site where the beneficiaries are invited at a pre-allotted time, or the other option is to conduct a household distribution. Do check with your local government authorities on what is permitted. If you're planning for a fixed site distribution, then the next step is to decide whether the location should be outdoors or indoors. It is ideally recommended to have a distribution outdoors. This is to ensure better ventilation and a bigger space to prevent crowding. Here is an example of a fixed distribution at an outdoor site. You can see everyone maintaining a physical distance in the waiting area to prevent the spread of infection. Notice how there are 2 separate hand-washing stations, one for the service provider and another for the beneficiaries. Here you can see the service provider keeping a safe distance from the beneficiaries and is not touching the child. The mother is supporting the child's head and keeping the child's mouth open. The other option is to conduct a fixed site distribution indoors, for example, at a health facility or barangay center. This is a map of the indoor site. Notice there are separate entry and exit points to prevent crowding. There are sufficient windows for good air circulation and ventilation in the room. The beneficiaries arrive at point 1 and first wash their hands at the hand-washing station at point 2, near the entrance. You will also notice that the service provider has a different hand-washing station inside at point 4. At point 3, beneficiaries wait in the waiting area, maintaining a physical distance, and when it's their turn, they go to point 5 where the service provider is dosing the children with vitamin A and deworming. At point 6, you will notice a different person maintaining the records. After finishing dosing and record keeping, the beneficiaries leave immediately through another door at point 7, which is the exit point. In this indoor site, you can see the service provider keeping a safe distance from the beneficiary and is not touching the child while dosing. The mother here is supporting the child's head and keeping the child's mouth open. When the fixed site distributions are not possible or are not recommended, household distribution can be planned. In a household-level distribution, it is important to identify where the eligible children reside. Eligible children or households are those that have children aged 6 months up to 5 years. If anyone in the house is sick or showing symptoms of COVID-19, it is advised to schedule a visit to that house on a later date. This is an example of a vitamin A and deworming distribution at the household level. Note how the health worker does not enter the house. Everyone is wearing a mask and a face shield. The health worker is keeping a safe distance between the family and herself. Remember to wash your hands with soap and water before dosing every child, and do not touch the child. Ask the caregiver to support the child's head and to keep the child's mouth open. Let us now have a look at the supplies required before we plan a distribution. It is important to check if you've got all the supplies required for the day of distribution. The supplies include vitamin A capsules, albendazole tablets, hand sanitizers or soap and water, clean scissors, tissues or clean towels, blank paper for the albendazole crushing, a glass bottle or any other object for crushing, a trash can or waste bags to put the empty capsules or crushed papers, a pen for record keeping, and a distribution register to record the names of the children, their age, and the doses given that day. It would be good to have a checklist of the supplies and materials you will need on the distribution day. Let us quickly recap what we've learned so far. In a fixed distribution, preferably distribute outdoors in an open area. Choose a site which is well ventilated, spacious enough to avoid crowding, has hand washing facilities for both the service providers and the caregivers, and a different entry and exit points for the caregivers. Gather all the supplies required before the distribution as per the checklist. Clean the supplies after using. Assign a separate person for record keeping.